people who come to my practice and look at my website and look at my social media photos often wonder, what's the difference between Bioclear veneers and porcelain veneers? Because I offer them both. Okay, most people don't do that. Most people do just porcelain veneers, and we do a lot of porcelain veneers. They're about 50-50, I would say. Porcelain veneers are something that covers up the front of the tooth, made of porcelain, that can change the shape of the tooth, the color of the tooth, and can really transform a smile. And when done properly, it can make a beautiful smile last a long time, and done in a minimally invasive way. Now, Bioclear veneers is a technique of composite veneers. Composite is more like a plastic material. So porcelain is more like a glass material. Composite is more like a plastic material. And it's a way, Bioclear is a technique of how to do composite veneers. So we call them Bioclear veneers, or sometimes Bioclear Composite Veneers. Bioclear veneers are something, we take this plastic material in this technique, and we have tooth-shaped matrices that fit around a tooth in a perfectly anatomical way. And then we heat up this material, and I flow it around the tooth. I then sculpt the tooth. So just like a sculptor Michelangelo carving out a rock, I'm carving out your tooth. I bring down this bulk of material to make it look like a tooth. So there's pros and cons in doing the porcelain versus the Bioclear. And we talk about, some people want one or the other, but they're only a better candidate for one or the other. So I'm going to talk about some of the pros and cons. So porcelain veneers, when done well, which often they're not, meaning that a lot of porcelain veneers look not as natural, or not even natural. I mean, you're not always looking for a perfectly natural, but I'm looking for an idealized natural. That's what my patients want, and that's what I like giving. Most just look fake. So, that's not what I do. Sometimes patients will kind of push us that way, and we can get them too white or something, but we're trying to make an idealized natural look, and when done properly, porcelain veneers will look better than Bioclear veneers, okay? But with porcelain veneers, you do have to do, on almost all cases, a little bit of damage. Now, back in the day when porcelain veneers were first came into the scene, and some of these makeover shows 20 years ago, and some of the academies teaching back then, where the porcelain veneers were pretty damaging to the tooth. Nowadays, with techniques I do, it's very minimally damaging. Now, it depends a little on the shape of the tooth and how much damage you had on the tooth previously, meaning old cavities and broke and things like that. But we always do as minimally invasive as possible, taking as little tooth structure as possible to do porcelain veneers. With Bioclear veneers, though, almost always, we do no damage to the tooth. It's almost all additive. So what happens when you add to the tooth? One, you're not doing any damage. So the tooth underneath it, if we ever need to fix anything in the future, has done no damage, it's going to last longer. And the goal always is to get it lasting to the end of your life. So that's a big one, and that's the most important reason. Sometimes people they think they want Bioclear veneers or composite Bioclear veneers because they think it's really cheap. It's not really cheap, okay? It is less expensive than porcelain veneers, but maybe 25% less expensive. So with so that's the best reason if you're really concerned about conservativeness. And for some people that really matters. Other people want them to look the absolute best, and then we're doing porcelain veneers. Now also, if we're want a huge color change, if your teeth are not white and you want white teeth and they're really yellow, Bioclear is not a great choice. You can do it, but especially if it's a huge color change, the dark or yellowness underneath is going to shine through the material, the composite material, and it doesn't look great, and it doesn't change the color perfectly. With porcelain veneers, you can block out the colors very easily. So if we're doing a huge color change, we're usually pushing towards porcelain veneers. Porcelain veneers usually last longer, okay? Average porcelain veneer, we're looking at about 10-15 years, okay? I've veneers 20 plus years old, but that's what we're going for, okay? Bioclear veneers made of not a strong material, so it's lasts on average, okay, what most dental work lasts, most fillings and crowns last, which are about 7 to 10 years. Now this is neither one of those are expiration dates. They're not going to fall off at that time. Just at that time, things usually will look a little chipped or stained or old, and it's either time to replace them So in porcelain veneers, you cannot repair them. If something chips or breaks or it's time to replace them, you have to replace the whole thing, okay? With Bioclear, you can repair it. You can refurbish it. So your rejuvenated tooth with Bioclear, and then if it breaks or chips, you can add to it and repair it. After 10 years, you can maybe take some of it back and rebuild it. But those are differences as well. So again, porcelain, more expensive, better looking, stronger, lasts longer. Bioclear, a little less expensive, can be repaired, doesn't last quite as long, still very beautiful, but number one reason to choose Bioclear is it's conservative, if that's what's concerning you, okay? Now both of these are more conservative. Like if you've had crowns in your back teeth and have had a lot of big fillings before, porcelain veneers are more conservative than those, okay? Less tooth structure. If you had that before, you shouldn't be so concerned in the front, but that's a personal decision, okay? So with me, we always try and keep as conservative as possible. We have multiple options. Now, something else with Bioclear, there are certain things you can do with Bioclear that you can't do with porcelain veneers. Number one is black triangles, okay? So black triangles are, if you look at your smile and you look at the little pink gums that come between your two teeth, on some people, that pink triangle is gone, okay? Most commonly, if you had braces and the teeth straightened, and then the space didn't fill in. That's the most common reason. So after Invisalign or braces, it's super common to have black triangles. Other reasons, you have gum issues or gum disease, it sometimes can happen as well. Now those aren't really, there's nothing unhealthy per se about having a black triangle there, but some people hate them. They hate them. Some people don't smile at all because they think people are looking at their black triangles. They think people tell them all the time, oh, you got something stuck in your teeth, like a seed. It's not something stuck, it's just a space. So because they're between the teeth here, it is very difficult. You cannot get just a regular filling in there, and it just causes a ledge, and stuff gets caught underneath there, and it's not healthy. So in the past, there was no good way to fix that. Now porcelain veneers can fix that, but you have to be, you have to destroy a little bit of tooth to do the porcelain veneer, and on some teeth, you have to destroy too much tooth. Now if the tooth is beautiful and pretty, and you're happy with your smile, except for the black triangle, then it doesn't make a lot of sense to do a porcelain veneer if you already have pretty teeth. So with Bioclear, we do Bioclear black triangle closure, where we take those anatomical, those tooth-shaped matrices, little pieces of plastic, they're tooth-shaped, that I was talking about earlier, and we slide it between the teeth, and then we can inject, we call it injection molding. So we're injecting heated composite around the tooth into this perfect tooth shape in that corner, filling that area in. And it's smooth and has a perfect margin. You can brush it and floss it, and it's healthy and it looks good. It'll make your tooth close that space in. So that's one of the things that Bioclear has over porcelain veneers in most cases. Unfortunately, not a lot of people know how to do this technique. I do teach it around the country at times, and it's been around for over a decade, and we're trying to teach more dentists it. But it's probably one of the more common things that people come from hours away and fly in from other states to get done by me. It takes one appointment. Oh, that's another difference as well. That's another difference as well, is that with the Bioclear, it's done in one appointment. Okay, so you come in, we sit down, we do it, and it's done. With porcelain veneers, we have to we do what's called a wax up. We plan it beforehand. You come in, you get temporaries, and then you come back usually a few weeks later to get the permanents in. So it's a longer process. Porcelain veneers also. There's a benefit of that longer process, though. One of the benefits is that when we do porcelain veneers, we get a temporary set. Now, if you've ever had a crown on your back tooth, we can put a temporary on there while we're making the real crown. That's just there to keep it covered, so it's not sensitive and hold the teeth in place. The front ones are there for that reason also, but it's not the only reason. It's not even the main reason. The main reason, at least when I do them, is that's my smile test drive. It's my trial smile. So I've designed your smile what I think it's going to look like, what I think will look good in your mouth. Then we put it on your teeth. Now we have these temporaries. Now you come back a day or two after we've done it so that you're not numb, and we can look at it together, and we can make any changes to those temporaries. Make them longer, shorter, rounder, whatever. And then when we're happy with that, we're like, oh, this looks amazing. Then we take photos and digital scans of that. Then I show my amazing ceramicist that, and then he takes that and designs the even better version for the final porcelain veneers. With Bioclear, we do often do a mock-up beforehand, so we get a preview of what it looks like, but you can't really, but not as detailed as the porcelain veneers. So once you come in, you sit down for often 5-6 hours, depending on how many teeth we're doing, and we make this awesome smile, and you sit up, and you've never seen this before, and you're like, ah, and some people love it right away, other people don't know, and that's normal, that's perfectly normal. We just made a huge change, but then we have you come back a few days later, and we make any minor changes, but people love it. So those are the differences between Bioclear and porcelain veneers. Pros and cons. If you send in a virtual consult, you do that by clicking the link in my bio on Instagram or going to my website, and you tell me what you're interested in. I can tell you whether you're a good candidate for it. I can tell you that you're better for this one or better for this one, or you can do both as long as you understand, either one would be a good candidate for, depending on what you're interested in. So that's what the difference is. I talk about this all the time. I know it's a lot of information, but I have this question asked to me all the time. So if it's something you're interested in, now you know a lot more about it. And both great tools for transforming your smile. And these wall behind me, we have both. This is Bioclear, porcelain, Bioclear. So it's both, and they both can look great. All right, hope that helped.